National Preparedness Month webinar. Prepare an emergency supply kit. National Preparedness Month. September is National Preparedness Month, and we should encourage first responders and their families to make a commitment to prepare for emergencies by following 3 simple steps. 1. Be informed before, during, and after an emergency. 2. Make a family emergency plan. 3. Get an emergency supply kit. Emergency supply kit. Today we will go over preparing an emergency supply kit. One for home, a smaller portable kit to take with you if you have to suddenly leave. If possible, make additional kits for your office or car. We will also cover maintaining and storing your kit, as well as a safety maintenance check for your vehicle to reduce hazardous driving conditions. A basic emergency supply kit should include 1 gallon of water per person per day for 3 days, and remember to include water for your pets as well. At least a 3-day supply of non-perishable food. Select foods that require no refrigeration, preparation, cooking, and little or no water, and choose foods your family will eat, such as ready-to-eat canned meats, peanut butter, protein or fruit bars, and dry cereal or granola. A manual can opener and eating utensils, battery-powered or hand-crank radio, and a National Oceanic and Atmospheric Administration or NOAA weather radio with tone alert and extra batteries for both. Flashlight and extra batteries. Change of clothes for each family member. Extra set of house and car keys. Some extra cash. First aid kit. A whistle to signal for help. Dust mask to help filter contaminated air, and plastic sheeting and duct tape to shelter in place. Your kit should also include moist towelettes, garbage bags, and plastic ties for personal sanitation, wrench or pliers to turn off utilities, local maps, important family documents such as copies of insurance policies, IDs, passports, school and vaccination records, income tax records, birth certificates, bank account records, photo albums, and other valuable documents in a waterproof portable container. If you have time, consider scanning documents and saving it to a USB flash drive along with digital photos. Remember, if time is short, never compromise safety for personal belongings. Cell phones and two-way radios or other devices for communicating with the agency or department to coordinate assignments. It is also a good idea to consider special needs of family members. Those might include infant formula and diapers, pet food, extra water for your pet, leash, carrier, and collar, books, games, puzzles, or other activities for children, prescription medications, and an extra pair of contact lenses and glasses. Water. Water is an essential element to survival and a necessary item in an emergency supply kit. Following a disaster, clean drinking water may not be available. Your regular water source could be cut off or compromised through contamination. Prepare yourself by building a supply of water that will meet your family's needs during an emergency. How should you store water? It's recommended you purchase commercially bottled water in order to prepare the safest and most reliable emergency water supply. Keep bottled water in its original container and don't open it until you need to use it. Observe the expiration or use-by date. Store in a cool, dark place. How much water do you need? You should store at least 1 gallon of water per person for 3 days. A normally active person needs about 3/4 of a gallon of fluid daily from water and other beverages. However, individual needs vary depending on age, health, physical condition, activity, diet, and climate. To determine your water needs, take the following into account. 1 gallon of water per person per day for drinking and sanitation. Let's go over how you should prepare your own containers of water. It's recommended you purchase food-grade water storage containers from surplus or camping supply stores to use for water storage. Before filling with water, thoroughly clean the containers with dishwashing soap and water and rinse completely so there's no residual soap. If you use your own storage containers, choose 2-liter plastic soft drink bottles, not plastic jugs or cardboard containers that have had milk or fruit juice in them. Milk protein and fruit sugars cannot be adequately removed from these containers and provide an environment for bacterial growth when water is stored in them. Cardboard containers also leak easily and are not designed for long-term storage of liquids. Also, do not use glass containers because they can break and are heavy. Children, nursing mothers, and sick people may need more water. A medical emergency might require additional water. If you live in a warm weather climate, more water may be necessary. In very hot temperatures, water needs can double. Keep at least a 3-day supply of water per person. Follow these steps for storing water in plastic soda bottles. Thoroughly clean the bottles with dishwashing soap and water and rinse completely so there's no residual soap. Sanitize the bottles by adding a solution of 1 teaspoon of non-scented liquid household chlorine bleach to a quart of water. Mix the sanitizing solution in the bottle so that it touches all surfaces. After sanitizing the bottle, thoroughly rinse out the sanitizing solution with clean water. Fill the bottle to the top with regular tap water. If the tap water has been commercially treated from a water utility with chlorine, you do not need to add anything else to the water to keep it clean. If the water you are using comes from a well or water source that is not treated with chlorine, add 2 drops of non-scented liquid household chlorine bleach to the water. Let the water stand for 30 minutes before using. A slight chlorine odor should be noticeable in the water. If not, add another dose of bleach and allow the water to stand another 15 minutes. Tightly close the container using the original cap. Be careful not to contaminate the cap by touching the inside of it with your finger. Place a date on the outside of the container to know when you filled it. Store in a cool, dark place. Water can also be treated with water purification tablets that can be purchased at most sporting goods stores. Water that has not been commercially bottled should be replaced every 6 months. More information on water treatment is available at redcross.org. Managing water. Allow people to drink according to their needs. Many people need even more than the average of 1 gallon per day. The individual amount needed depends on age, physical activity, physical condition, and time of year. Never ration drinking water unless ordered to do so by authorities. Drink the amount you need today and try to find more tomorrow. Under no circumstances should a person drink less than 1 quart, which is 4 cups of water each day. You can minimize the amount of water your body needs by reducing activity and staying cool. Drink water that you know is not contaminated first. If necessary, suspicious water such as cloudy water from regular faucets or water from streams or ponds can be used after it's been treated. If water treatment is not possible, put off drinking suspicious water as long as possible, but do not become dehydrated. Do not drink carbonated beverages instead of drinking water. Carbonated beverages do not meet drinking water requirements. Caffeinated drinks and alcohol dehydrate the body, which increases the need for drinking water. Turn off the main water valves. You will need to protect the water sources already in your home from contamination if you hear reports of broken water or sewage lines, or if local officials advise you of a problem. To close the incoming water source, locate the incoming valve and turn it to the closed position. Be sure you and your family members know how to perform this important procedure. Let's review water sources. The following are safe sources of water: melted ice cubes, liquids from canned goods such as fruit or vegetables, water drained from pipes. To use the water in your pipes, let air into the plumbing by turning on the faucet in your home at the highest level. A small amount of water will trickle out. Then obtain water from the lowest faucet in the home. Water drained from the water heater is another safe source. To use water in your hot water tank, be sure the electricity or gas is off and open the drain at the bottom of the tank. Start the water flowing by turning off the water intake valve at the tank and turning on the hot water faucet. After you are notified that clean water has been restored, you will need to refill the tank before turning the gas or electricity back on. If the gas is turned off, a professional will be needed to turn it back on. The following are unsafe sources of water: radiators, hot water boilers such as home heating systems, water from the toilet bowl or flush tank, waterbeds. Fungicides added to the water or chemicals in the vinyl may make water unsafe to use. Swimming pools and spas. Chemicals are used there to kill germs. The following are guidelines for water treatment. If you've used all of your stored water and there are no other reliable clean water sources, it may become necessary in an emergency situation to treat suspicious water. Treat all water of uncertain quality before using it for drinking, food washing or preparation, washing dishes, brushing teeth, or making ice. In addition to having a bad odor and taste, contaminated water can contain microorganisms, germs, that can cause diseases such as dysentery, cholera, typhoid, and hepatitis. There are many ways to treat water. None are perfect. Often the best solution is a combination of methods. Before treating, let any suspended particles settle to the bottom or strain them through coffee filters or layers of clean cloth. Make sure you have the necessary materials in your disaster supply kit for the chosen water treatment method. Let's go over the effectiveness of water treatment methods. Boiling and chlorinating the water will kill microbes, but will not remove other contaminants such as metals, salts, and most other chemicals. Distilling the water will kill microbes and remove other contaminants. Food. Consider the following things when putting together your emergency food supplies. Store at least a 3-day supply of non-perishable food. Remember any special dietary needs. Avoid foods that will make you thirsty. Choose salt-free crackers, whole grain cereals, and canned foods with high liquid content. Following a disaster, there may be power outages that could last for several days. Stock canned foods, dry mixes, and other staples that do not require refrigeration, cooking, water, or special preparation. Be sure to include a manual can opener and paper cups, plates, and plastic utensils. Non-perishable food. Choose non-perishable foods your family will eat, such as ready-to-eat canned meats, fruits and vegetables, protein or fruit bars, dry cereal or granola, peanut butter, dried fruit, crackers, canned juices, non-perishable pasteurized milk, high-energy foods, food for infants, comfort and stress foods, nuts. Maintain your kit. Just as important as putting your supplies together is maintaining them so that they're safe to use when needed. Here are some tips to keep your supplies ready and in good condition. Keep canned food in a cool, dry place. Store boxed food in tightly closed plastic or metal containers to protect from pests and to extend its shelf life. Throw out any canned good that becomes swollen, dented, or corroded. Use foods before they go bad and replace them with fresh supplies. Place new items at the back of the storage area and older ones in the front. Change stored food and water supplies every 6 months. Be sure to write the date you store it on all containers. Rethink your needs every year and update your kit as your family needs change. Keep items in airtight plastic bags and put your entire disaster supplies kit in 1 or 2 easy-to-carry containers, such as an unused trash can, backpack, or duffel bag. Kit storage locations. Since you do not know where you will be when an emergency occurs, prepare supplies for home, work, and vehicles. Let's go over kit storage locations. Your disaster supplies kit should contain essential food, water, and supplies for at least 3 days. Keep this kit in a designated place and have it ready in case you have to leave your home quickly. Make sure all family members know where the kit is kept. Additionally, you may want to consider having supplies for sheltering for up to 2 weeks. In case you are stranded, keep a kit of emergency supplies in your vehicle. This kit should include jumper cables, flashlights and extra batteries, first aid kit and necessary medications in case you're away from home for a prolonged time, food items containing protein such as nuts and energy bars, canned fruit, and a portable can opener, water for each person and pet in your car, AM/FM radio to listen to traffic reports and emergency messages, cat litter or sand for better tire traction. Your vehicle emergency supply kit should also include a shovel, ice scraper, warm clothes, gloves, hat, sturdy boots, jacket, and an extra change of clothes, blankets or sleeping bags. You also might want to consider a fully charged cell phone and phone charger, flares or reflective triangle, baby formula, and diapers if you have a small child. Be prepared for an emergency by keeping your gas tank full, and if you find yourself stranded, be safe and stay in your car. Put up your flashers, call for help, and wait until it arrives. Car safety. You can avoid many dangerous weather problems by planning ahead. Plan long trips carefully, listening to the radio or TV for the latest weather forecasts and road conditions. If bad weather is forecasted, drive only if absolutely necessary. Check or have a mechanic check the following items on your car. Keep your gas tank full in case evacuation is needed. Do not drive through a flooded area. Just 6 inches of water can cause a vehicle to lose control and possibly stall. A foot of water will float many cars. Be aware of areas where floodwaters have receded. Roads may have weakened and could collapse under the weight of a car. If a power line falls on your car, you are at risk of electrical shock. Stay inside until a trained person removes the wire. Antifreeze levels. Ensure they're sufficient to avoid freezing. Battery and ignition system should be in top condition and battery terminals should be clean. Check brakes for wear and fluid levels. Have your car's exhaust system checked for leaks and crimped pipes and repair or replace as necessary. Carbon monoxide is deadly and usually gives no warning. Fuel and air filters. Replace and keep water out of the system by using additives and maintaining a full tank of gas. A full tank will help keep the fuel line from freezing. Heater and defroster. Ensure they work properly. Lights and flashing hazard lights. Check for serviceability. Oil. Check for level and weight. Heavier oils congeal more at low temperatures and do not lubricate well. Make sure your thermostat works properly. Windshield wiper equipment. Repair any problems and maintain proper washer fluid level. Install good winter tires. Make sure the tires have adequate tread. All-weather radials are usually adequate for most winter conditions. However, some areas require that to drive on their roads, vehicles must be equipped with chains or snow tires with studs. If there's an explosion or other factor that makes it difficult to control the vehicle, pull over, stop the car, and set the parking brake. If the emergency could impact the physical stability of the roadway, avoid overpasses, bridges, power lines, signs, and other hazards. In closing, here's a summary of what we've reviewed. What should go in a disaster emergency supply kit? Essential food, water, and supplies for at least 3 days. A basic emergency supply kit should include 1 gallon of water per person per day for 3 days. And remember to include water for your pets as well. Keep emergency supply kits in a designated place and have ready in case you need to leave your home quickly. How to store water, prepare safe water, and manage water sources. Tips for car safety and how to prepare a vehicle emergency supply kit. The importance of emergency supply kit storage. Remember, emergency preparedness starts with you. Plan, prepare, train. Be ready when the time comes. Check out all the webinars the Illinois Department of Public Health Office of Preparedness and Response is offering to support awareness of National Preparedness Month in September. They include Be Informed and Stay Informed during and after an emergency, Preparing an Emergency Supply Kit as we just listened to, Disaster and Emergency Planning, and Preparing for a Flood or Tornado. This concludes this presentation.